Welcome to Health Nugget Media Channel, where we provide health-related nuggets and answer critical health questions to give valuable guides. Please subscribe to this channel. Today, we'll be discussing a topic that requires special attention: 7 common symptoms and treatments of leukemia in children. Leukemia is a type of cancer that affects the blood and bone marrow, and it is essential to raise awareness about its signs and treatments. Throughout this video, we'll be citing information from reputable medical journals to ensure accuracy and credibility. So let's dive right in. Overview of leukemia. Before we delve into the symptoms and treatments, let's briefly understand what leukemia is. Leukemia is a cancer of the blood-forming tissues, mainly the bone marrow and blood. The disease is characterized by the uncontrolled production of abnormal white blood cells, which interfere with the normal functioning of healthy blood cells. In children, leukemia is the most common type of cancer, and early detection is crucial for successful treatment. Common symptoms of leukemia in children. Identifying the symptoms of leukemia in children can be challenging, as they can resemble those of other common childhood illnesses. However, there are specific warning signs that parents and caregivers should be aware of. 1. Fatigue and weakness. According to Schmeijlo et al., 2012, children with leukemia may experience persistent fatigue and weakness, which can be attributed to reduced red blood cell count, leading to anemia. 2. Frequent infections. According to Salzer et al., 2013, leukemia can weaken the immune system, making children more susceptible to infections. Recurring or severe infections may indicate a potential problem. 3. Bruising and bleeding. According to Taube et al., 2016, easy bruising and excessive bleeding, even from minor injuries, can be indicative of low platelet counts in the blood. 4. Bone and joint pain. According to Terwilliger and Abdul-Hay, 2017, leukemia can cause pain in the bones and joints due to the infiltration of leukemic cells. 5. Swollen lymph nodes. According to Schrapp et al., 2012, enlarged lymph nodes, especially in the neck, armpit, and groin areas, can be a sign of leukemia. 6. Loss of appetite and weight loss. According to Olsen et al., 2013, leukemia can lead to a decreased appetite and unintentional weight loss in children. 7. Abdominal discomfort. According to Balter et al., 2014, enlargement of the liver or spleen. Leukemic cell accumulation can cause abdominal pain or a feeling of fullness. Diagnosis and treatment. If you notice any of these symptoms persisting in your child, it is essential to consult a pediatrician promptly. Timely diagnosis plays a vital role in managing leukemia effectively. The diagnostic process usually involves a combination of blood tests, bone marrow aspiration, and imaging studies. Now, let's explore some of the common treatment approaches for childhood leukemia. 1. Chemotherapy. According to Silverman et al., 2016, chemotherapy remains the primary treatment for most children with leukemia. It involves using powerful medications to destroy cancer cells and promote remission. 2. Radiation therapy. According to Pui et al., 2015, in some cases, radiation therapy may be used to target and destroy leukemia cells, especially when the disease has spread to the central nervous system. 3. Stem cell transplantation. According to Muffley et al., 2016, for high-risk cases, or when initial treatments don't lead to remission, a stem cell transplant from a compatible donor can be a viable option. 4. Targeted therapy. According to Tichy et al., 2012, targeted drugs can be used to block specific proteins or molecules involved in the growth of leukemia cells. This approach aims to be more precise and less harmful to healthy cells. 5. Immunotherapy. According to Maud et al., 2014, immunotherapy helps boost the body's immune system to recognize and attack leukemia cells more effectively. This treatment approach shows promising results in certain cases. However, it's important to note that each case is unique, and some children may experience relapse or long-term side effects from treatment. Regular medical follow-ups are crucial to monitor the child's progress and address any concerns promptly. Always consult a qualified healthcare professional for accurate diagnosis and personalized treatment recommendations. Thank you for watching this video. Try to comment below and share this video. Please, don't forget to like and subscribe to this channel.